Good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and today we are going to be talking about bone marrow transplant, and all the things that are involved with that. To discuss this topic, we have two special guests. To my right is Gaytri Kapoor, who is involved with the BMATCH, that's the Gulf Coast Bone Marrow Transplant Association, and next to her is Dr. Ravi Pingali. He is with the Houston Methodist Hospital. He is an oncologist, hematologist, and a bone marrow specialist. Welcome to Triple N Media. We are delighted to have you.
Thank
and
you.
all our programs are video streamed through our YouTube channel, Nik Nikam, where we have more than 1,300 videos accenting our experience in the United States. And please do subscribe to our YouTube channel. And let's start off with Dr. Pingali, a little bit about your background, and then we'll jump right into bone marrow topic.
I'm Dr. Ravi Pingali. I'm currently an assistant professor at Houston Methodist Hospital, and I do mainly heme malignancy treatments, and also I deal with bone marrow transplant patients. Before coming to Houston, I trained in South India. That's where I did my medical school, and then moved to England, where I did some training towards Royal College of Physicians. And after that, I moved to Wisconsin, where I stayed for 6 years doing my residency and fellowship, then an additional year of training at MD Anderson with special focus on bone marrow transplantation. And after completion of my training, I started working at Houston Methodist about 4 years ago now.
That's
Thank you for inviting me here.
Sure. Okay, let's talk about, for the benefit of general public, what is bone marrow and what does it do?
Bone marrow is a place in our body which is in between the bones, or it's the cavity in the bones from where the blood cells are produced. It's like the bone marrow factory, to keep it simple, where all the blood cells are produced. And as we grow older, only certain parts of our body or certain bones of our body make the bone marrow. Mm-hmm. But when we are in our mother's wombs, it's liver and spleen are the places where the blood cells are produced. And when we are born, all the bones have hollow cavities in them, and from there the blood cells are produced. And as we become adults, it's only the flat bones, which is going to be skull bone, the breastbones, the ribs, and the hips are the places from where the blood cells are produced. And that's where the bone marrow is essentially is producing the cells for us.
Like the factory produces the red blood cells, the white blood cells,
correct,
platelets.
So the bone marrow factory, which is bone marrow, produces the red cells, the white cells, which are the immunity cells, and also the platelets, which prevent us from bleeding. So as a whole, our bone marrow does the function of our blood, supplying our blood, and also the most important one is the immunity of the body is derived from the, correct. We are exposed to so many viruses on day-to-day basis, and we don't get really sick because we may have exposed to them at some point of time, and our bone marrow and our immunity recognizes that, hey, I have dealt with this in the past and I'm going to handle it. You don't have to worry about it.
That's fascinating. Since we are going to be talking about the bone marrow transplant, let's talk about why would someone need a bone marrow transplant?
So there can be several different reasons why people need bone marrow transplant. It can be because they have a cancer related to the blood system, or defect in the blood production itself, so where it's called a bone marrow failure, or if it's a cancer of the bone marrow, which is like leukemias or lymphomas, that will be one situation. And rarely what we call it as glycogen storage disorders or lack of immunity, as though the blood counts may be normal, but the immunity is not intact. So in those conditions also we recommend bone marrow transplant, and that is a definitive treatment or a curative option for a lot of patients who don't have treatments otherwise.
Ladies and gentlemen, you are watching a Triple N Media. We are talking about the bone marrow and bone marrow transplant. Now I'm going to turn to Gaytri Kapoor, who is been a good friend of mine for many years. Let's talk about what is Be the Match. Tell us about something about the Be the Match.
Be the Match is the donor database that helps patients connect with their matching donors for the bone marrow transplant. Be the Match is the largest registry worldwide. Total, we have almost 21 million registered donors worldwide, and out of that, around 14 million are from Be the Match. So Be the Match helps connect patients with their matching donors when they don't have a perfect match in their family.
Okay, talking about donors, how do you go about finding donors?
So, again, first thing is if you have siblings, those people are more likely to be a match. So what we are trying to do is not the blood group or blood type here. It's called tissue typing, or HLA match is what we are looking for. And the first place we normally look for, if somebody has an identical twin, they are going to be a good match, probably the best match. Okay. The next best match will be a HLA matched sibling. And there's about 25% chance that a sibling could be a match, 100% match, and there is a 50% chance that they are half match, and 25% chance that they are not a match at all, depending on how the genetic material is derived from parents.
Yeah. Gayatri, maybe you can tell us about your Be the Match program and how it works, and tell us your involvement with this project and how you get donors or potential donors to take part in this endeavor.
See, as I said, Be the Match is a donor database that helps connect patients with their matching donors. And usually patients, when they need the match, their doctors send us the request to look for a match. If we have a match, we reach out to the donor, no matter where the donor is. We reach out to the donors and then we do some testing. Usually it's a blood test. That is called the confirmatory testing. And if we find the perfect match, then we arrange the donation after the medical evaluation. And in this program, the donor and the patient doesn't have to be in one place. They can be in two different continents. And still, if they are a match, we can facilitate the donation. And after the donation, we take the donation to the patient. So the patient doesn't need to travel. Donors doesn't need to travel wherever the donors are. They can give the donation. But the thing is, to finding a matching donor becomes a challenge. In millions of people that registered in the registry, still it's a challenge to find a matching donor. As Dr. Pingali said, 25% patients find a match in their family, the perfect match. And basically the 75% patients depend on unrelated donors of their own ethnicity. And that's where Be the Match gets in and connect with their donors. And usually when we get a request, if the patient is Caucasians, have significantly higher chance of finding a matching donor because the South Asian patients have a better chance to find a match from the South Asian community.
Correct.
And since our community is not that much represented, we have a hard time finding a matching donors for our patients.
So how do you go about finding people who want to be in the registry? We do the awareness programs. We do the registration at different places. We go to colleges. We go to the workplaces, corporations, and not only that, we go to religious places, whether it's temples, mosque, everywhere we go. And we educate people, and interested people can sign up. It's a very easy process. It's just a simple cheek swab test. And people can register at the convenience of their home also. On their phone, they can just register online. And 4 days, they receive the kit like that at their home. And it comes with the cheek swabs. There are 2 cheek swabs in it. They just need to... Oh, I'll take that. Yeah. They just need to take the swab and mail it back. And it's very convenient. It's just
That's it they need to do, and with that we can test their immune system markers, and then we add them into the registry, and they become part of the donor database, and it means they get searched for all the patients who need the transplant. If any of them matches, then we reach out to them for further testing. Yeah. But the first step is, it's very easy. They can do it at the convenience of their home, and they just need to swab it and mail it back.
So how many South Asian people are here, and how many people are on your registry?
I'll tell you, unfortunately, South Asian representation is very low. We hardly have 2.5% of the registry South Asian. That's the reason it's a huge challenge for our patients to find that matching donor.
So how can people get involved with this match program? Talk about some other volunteer programs
yes,
that match has got.
Okay, so anybody who wants to get involved or wants to get sign up, register for the program, they can go to the website bethematch.org, and it's online registration. Go to join.bethematch/cure, and it takes just a few minutes to sign up. And if you are already signed up, there are still other ways that you can get involved. You can arrange the donor registration drives at your work, at your school, at your community, or anywhere that you are part of any group. You can arrange the events. All you need to do is set up a time and contact us, and we will come and educate the group, and we'll give all that information, what is involved being a donor.
Okay, maybe both of you can answer this question. And are there different types of bone marrow transplants?
Yes, there are different types of bone marrow transplant, and that's because of the need for different type of donors, because not everybody can find a perfect match. And to take forward what Ms. Kapoor was mentioning, there are about roughly 31 million people who have signed up to be volunteers for the donors. If somebody needs, they are very kind, and they all enrolled, and they are willing to donate. And of the 31 million people, vast majority, pretty close to 90% of representation on those registries is from Caucasian population. So that itself can help us in determining how small are the chances for non-Caucasian population to find a donor within the registry. So that actually led to other kind of alternative donors search, or alternative donor programs, or alternative sources of graft, what we call it as. So it can be cord blood transplantation, which is slightly more commonly done in kids, because the volume of the blood we can get, or the marrow product, or the cord blood product, what we can get from cords is small, and you don't get any extra if you need extra cord. And other option is half-matched donor transplant, where the donations can be done from 50% matched siblings, or from parents, or from children. And the other last one is called mismatched unrelated donors, where they are not 100% matched, maybe 90% or 80% match. And depending on how desperate the patient's needs are, we may pick and choose what kind of transplant or what kind of donor we are trying to select for that particular individual going through tough time.
So when you talked about cord, I'm sure you're talking about the umbilical cord.
That's correct.
And so do you, maybe we need to educate even expectant mothers that they could be saving another person's life by donating the placenta.
Yes,
that's absolutely right. And there are actually cord blood banks who are willing to store the cord blood. And one thing everybody has to understand is that cord blood, what you are expected mothers are trying to donate, is not for the child if they were to develop any kind of blood disorders in future, but that is actually going to the general pool, or it's a general bank, and if anybody is in need of it, it will be actually given to that particular patient. And the chances of the cord or directed cord donation to be useful, like for example, if a mother chooses to save the cord for the baby who was born with it, the chances that they will need is less than 0.02% or something. So it's a very, very little chance, and to try to save for something which the chance of needing is so low, you probably should not be doing and should be donating it to the
you probably donate it to somebody who needs it today and tomorrow.
Exactly.
Yes.
And
in that, I would like to add is Be The Match also helps with that. It's very easy. A lot of the hospitals are partners with us, but in case mothers are delivering to the place where the hospitals are not partners, still it's the easy process. They can register online, and the kit to store the umbilical cord blood can be delivered to their doorstep, and they just need to take the kit at the time of delivery. So after the cord is collected, so doctors send it to Be The Match. So all the mothers or the parents need to do is just register online, and the rest of the things is taken care by Be The Match.
How long can you all store this placental blood?
For several years, and the studies go as far as like 13-14 years in terms of testing whether the cells which we need for transplantation, whether they are still alive or viable, or they are able to do the function they are supposed to be doing, have been checked in this and they are still viable until at that point, 13-14 years. Maybe if we wait a little bit longer, we'll know the long-term data, because it has been just around.
Okay. Ladies and gentlemen, we are watching the Triple N Media, and we are talking about bone marrow transplant, and patients who might need bone marrow transplant. Please do subscribe to our YouTube channel, and please visit the website Be The Match and donate so that we can help another fellow human being. Okay, let's assume there's a young boy by name Sean, 20 years old. He's got leukemia and he needs a bone marrow transplant to survive. So walk us through what are the different steps that have to be taken.
So first thing we would do is explain to the patient the diagnosis, like what they're having, and whether the patient can do well just with chemotherapy alone, or whether they need a chemotherapy and or transplant in addition to keep the disease from coming back. And first step in treatment of leukemia is to put them in remission, what we call it, as so that there's no evidence of leukemia when we do fancy tests. Once the tests are conducted and there's no disease, that is the time when we consider they are eligible for transplant. But the transplant process, or the typing or tissue typing or the HLA typing for that, starts at the time of diagnosis, depending on what are the risk factors. There are certain criteria which we look for individual diseases, whether this patient is likely to need transplant. Then we try to start as early as possible, because if they don't have match within the family, we are looking for unrelated donors, and that can be a little bit longer process, because for all we know, the healthy volunteer donors may be at a different place compared to when they signed up, or they may be having something important in their life, that they may be getting married, or they may be having. So we need to plan ahead to try to match with their schedule. So once the patients are in remission, or if once the disease is gone, that's when is the ideal time to do the transplant process. So we then admit them to the hospital, give them intense chemotherapy, so that their body doesn't reject the transplanted cells. No matter how close the match is, the body knows what is its own and what is it not its own, and it tries to reject. On the contrary, the immunity and the blood cells or the stem cells, what we get from the donors, also think, okay, I don't belong here. I want to push the body away, what we call it as graft versus host disease. So during the transplant time, we give chemotherapy and immunosuppressive medications to make sure that they become friends, or we try to kind of calm the storm with all the medications. Yes.
Okay, let's talk about from a donor perspective. now this patient needs blood transfusion. I mean, bone marrow transplant. What are the things that happen with the donor?
Anytime we get the request, there is a match, so we reach out to the donors and we evaluate their health. We do the blood work, we do the physical medical evaluation to make sure that donors are not at any risk, and donating bone marrow is not going to put them in any risk even in future. Then there are two ways of donation, and one is peripheral blood stem cells, one is traditional bone marrow, and usually we get the request from patient's doctor which method is needed for the patient.
Correct.
And Dr. Pingali, here I wanted to ask you, are there any risk factor of donating bone marrow through either of the methods?
That's a very good question. Like a kidney donor, once you give kidney, probably you won't get it back, right? But for bone marrow transplant or stem cell donor or bone marrow donor, that is not a problem. They should get all their immunity and the blood recovery within a week time, and they shouldn't necessarily miss any of those donations they make or the immunity which they donate. So that's a very important thing, that you are not losing anything. And it is depending on what exactly is the indication or reason for the transplant. Physicians request, okay, some patients may have better outcomes with bone marrow product, and some may have better outcomes with stem cell product. And that will be determined on case-by-case basis, and we request the NMDP program to see if we can get one or the other products. But depending on, again, the donor probably can for sure say which method they prefer. And the risk-wise, there is no difference between the bone marrow product donation or stem cell product donation. They are very similar in their risks for the donor, and actually the risks for donor are very small. So compared to the what you are trying to accomplish with this, it is very little trouble you have to go through that.
And Dr. Pingali, can you please explain both of the donation methods?
So the bone marrow donation is done in an OR. Pretty much the patients are put to sleep and they are made to lie on the stomach, and two doctors work on either side of the body, and they take about 1 liter or so of the bone marrow product, which is going to be liquid or thicker form of blood to keep it simple. And we try to take the stem cells from there, or bone marrow cells from there, and try to give back the blood so that they're not losing the blood. We try to collect as much of the product we can get, and we try to give back the product which we don't need to the patient, because that is from the donor itself, so it should not have any risk, and they shouldn't be anemic either at the end of the procedure.
So you're drawing this marrow from the pelvic bones?
Correct, on the backside of the hips.
And how much is the recovery time for the donors?
Actually, they go home within an hour after they're extubated, and they come back to the hospital so that somebody from the medical team can check the wound, and that's about it.
That's all. So basically, recovery time is just a day or two?
A day or two, and at best, they may need some low potency pain medications like Tylenol and other medications, just to keep them a little bit comfortable, because it's going to be a little bit of soreness rather than pain, so to speak. When it comes to the stem cell donation, that's...
Before we go into that, before you do the bone marrow extraction, do you give them anything to stimulate their blood cells to produce more
often for
stem cells?
So for the stem cell donation, we usually do that, not for the bone marrow. Yes. For the stem cell donation, stem cells are actually in the marrow, but when we stimulate them with what we call it as growth factors, there are several different ones. When we inject it to the healthy donor, this bone marrow cells actually come out into the bloodstream. And when you check their blood counts at the time, their white count will be artificially and really high. That's a desirable thing we want for the patient so that we can collect enough number of cells. Higher the number of the cells or the white count, it would be roughly, you can say probably you're going to get enough stem cells for the
So actually, when we are extracting this blood from the bone marrow or the plasma itself, or the blood itself, are you getting all the red blood cell precursors and the white cells and platelet precursors, or the stem cells?
So yes, some of them, but our marrow has regenerative capacity that within no time they should get it back. It's like going and donating blood. Once you donate the blood, in a week, probably your hemoglobin, which has come down by 1 gram or 2 grams, would usually recover.
Yeah. Ladies and gentlemen, you are watching the Triple N Media. I am Dr. Nik Nikam, and we are talking about bone marrow transplant, and how it can benefit the people with various types of leukemias and bone cancers. My special guests are Gaytri Kapoor and Dr. Ravi Pingali. And okay, let's talk about, are there any circumstances where you say, well, the bone marrow is not going to be useful for a patient?
So you mean if we want to only specifically do stem cells instead of bone marrow?
Yeah, any type of bone marrow,
So if the donor themselves have a blood-related issue, we cannot use their blood or bone marrow product. Or sometimes if the donor has arthritis and we were planning on doing stem cells, if we give them the growth factor support, their arthritis and other things can flare. So to evaluate all these factors, even the donors actually go to a doctor's appointment, and they are seen by a bone marrow transplant doctor who is different from the doctor who is actually treating the patient, so that the doctor who is seeing the donor acts in the best interest of the donor. And they evaluate for the health conditions, make sure the donor's heart is in good condition and the lungs are able to handle all the stress they are going to go through the donation process. So unless there is a particular problem with the donor's blood system, or if they have had cancer between the time they signed up to the time they are called in to be a donor, there are multiple things which can make them ineligible if they have health issues. But if they are in good health, there should not be any condition why we don't want to use the blood.
Okay, so let's say we have received the bone marrow from the donor, and what process is involved as far as the patient or the recipient is concerned? Is it just like giving a blood transfusion or anything more involved?
That's correct. The patient will not need any surgery, so it's not like we are infusing into the bone marrow. They just have a IV, intravenous access, and like IV fluids or fluids are given to the patients, the same way the bone marrow cells are actually given as a transfusion. And they are monitored closely because it's from a different person. So they are hooked up to a monitor, and the nurse stands right at the bedside and watches to make sure they are not having any reactions. They get some medications so that even if there were to be any reactions, the chance of that happening are smaller. So the doctor comes and makes sure that the product is suitable for donation and it's going from right donor to the right patient. So there are multiple checks which are involved, and chain of custody, what we call it as, so that it goes from one person to another in a very specific way, and there is a very tight protocol which determines how we do that.
And one more question I had. So how is the recovery for the patient? You earlier mentioned that for the donor, recovery is just few days, and how it goes for the patient, the recipient?
For the patient, again, it depends on what is the reason why they are getting the transplant. So the recovery, if somebody has an immunodeficiency condition, can be much shorter versus somebody who is having leukemia and have had treatment multiple times or having had infections, their recovery can be much longer. So it depends on what is the patient's reason for getting the transplant.
What is the minimum time for be the match once a donor donates? We have 1 year time before we could even ask them to release their information with the patient. So is this that this much time is needed for patients to recover?
That's for the patients to recover, it is not that long. So they are in the hospital probably about 3 weeks or so after the infusion is done. So the day of the infusion is called day 0. By day 20, day 21, most patients are able to leave the hospital, but they are closely monitored 2 to 3 times a week by the transplant doctor, because the first 100 days are considered to be very crucial in terms of engraftment, because as I mentioned previously, we don't want either the body to reject those bone marrow cells or stem cells, and the stem cells to reject the body. So we try to monitor very closely and adjust the immunosuppression medication to keep a congenial environment for the graft to grow. Within first 30 days, we would know whether the graft is taken by the body or not, in most instances. And if we don't see that the patient's counts coming up by that time, then we start looking for the reasons if there is any problem with what we call it as engraftment, whether the graft has actually settled in or not.
Okay, let's talk about how does bone marrow transplant actually help patients with leukemia, bone cancer?
So leukemia is a cancer of blood and immune system. So here, what happens is like leukemia cells take over the bone marrow. So leukemia cells are rogue cells. They are not letting the blood cells do their job. The immunity cells do their job. So people with leukemia have problems with immunity, and that's why they are at risk for infections, and also at risk for bleeding and tiredness because their other normal blood cells are not being produced properly. So why people develop cancers in the first place is a question we need to ask, because their immunity is falling asleep on the wheel. Basically, one cancer cell decides to do its own thing, and the immunity thinks, okay, this is my own cell. I don't have to worry about this one cell which is causing me trouble. I can ignore. Eventually, one becomes 2 and 2 becomes 4. It keeps multiplying and causes cancer, or any kind of cancer. So leukemia is very similar in that. What we are trying to do with chemotherapy is to kill cancer cells, and despite the chemotherapy being aggressive, there will still be some cells left no matter what, because those are our own body cells. They know places to hide, and they know how to outsmart our immunity. So the way the transplant works is by replacing our blood system and immune system. It's like you're bringing reinforcement from elsewhere when your army is not working.
So is it, in the beginning you said the bone marrow is a factory, so basically when patients receive the transplant, the factory gets replaced?
That's correct. So we are trying to replace their blood system and, more importantly, immune system.
So let's talk about what is the success rate of a bone marrow transplant doing the things that we expect it to do.
So it is a very good question and very difficult answer to give it straight, because it depends on multiple factors. What is the reason why somebody is needing a transplant? So if somebody is needing it for leukemia, then the chances are less compared to somebody is needing for just a bone marrow failure, where even if there is a graft rejection, they are not going to have counts, but they are not going to have cancer, right? So it depends on what is the reason, what kind of donor we are able to find. That brings back to the first question we are asking, whether there is a donor within the family or not, or whether there is a donor within the unrelated donor registry or not. And finally, what is the general health of the patient, because they have to go through intense chemotherapy, and whether there is any graft rejection or graft versus host disease. So multiple factors play into this. So it's a very difficult answer to give.
That's Fascinating. Go ahead.
Yeah. Sometimes when we get the request for the donor, and sometimes by the time we get yes from the donor, and it happens that the patient is not ready for the transplant. Is it because that it took us too long to find a match, or that makes any difference in the treatment?
Correct. Some places, some situations, yes, the patients were only in remission, or the disease was so aggressive that even when it was gone, it came back very quickly within a matter of 1 or 2 months. So unfortunately, by the time, if the patient doesn't have a donor within the family, the time which it involves to find an unrelated donor can be much longer. And on an average, it could be up to 4 months. By the time patients, unfortunately, may have their disease come back and may never even go on to receive the transplant.
So it is, for the patient, it is better for them if they have a donor already existing in the registry and the donor respond back quickly
That's
for the
correct.
further testing. And if the bottom line is, if we have the donor and the donor is willing to donate and respond quickly, it's better for the patient.
That would be, yes. When somebody is committing themselves to donate, that's a noble thing by itself, and trying to respond sooner and trying to get it done for the patient is even more important, and that's a very good deed to do.
Ladies and gentlemen, you have been watching the Triple N Media. I am Dr. Nik Nikam, and we have been talking about bone marrow transplant, and conditions where we might be able to save a patient's life, and tell you how you can get involved. Please visit the website Be the Match and look at all the different ways you can volunteer your services, and also please be generous in making donation to the Be the Match, right, because all the services rendered by the Be the Match are free, right?
Yes, actually,
tell us about
yes.
that.
A lot of time I get asked that, okay, who's going to pay for the cost? We have different programs that covers the cost, but definitely it is sure that donors do not need to pay for anything, whether it is for the registration if they are young, and it's for the medical evaluation or the donation. So all this, the cost is covered by the program. So donors never pay for the program. And not only that, if a donor needs to take day off from work for the donation, usually it is a support from the employer. And if because of any reason somebody is working in the situation where they cannot receive a support from the employer, then we have other programs that kicks in. And for the students also, usually the colleges, the professors are very supportive to their donors. And we have worked in past where we needed the donation at that particular time. That was the time just before the exams. And the professors really cooperated with the donor and work around their donation schedule. Most of the time we do get all the support. I don't remember any time when a student needed support from the professor, they did not get it. So basically all the support for the donors is available, whether they are students or they are working, and all what we need is their commitment to donate and their respond quickly. A lot of time I get that, oh, I wanted to help, but the thing is, it's too busy. I just did not get a time to call back or respond back. And sometimes it happens that they take too long to respond, and then the patient sometimes doesn't have that much time. So even though the donors are committed, they cannot help the patient on time.
Thank you so much. Ladies and gentlemen, we have been talking about bone marrow transplant, bone marrow, and patients who might need this
show the pictures of the patient.
Bone marrow transplant, and it can make a difference between life and death in certain circumstances. So thank you so much, Dr. Pingali and Gaytri Kapoor. And here are some of the patients. Gaytri, you want to explain to this?
Yes, these are the kiddos in need of the bone marrow transplant. I'm not sure if you can see. The bottom one is Eva, and she has beta thalassemia. She's 9. Ever since she's born, she's been receiving blood transfusions every few weeks. and she has developed so many other conditions along with that. For her, the cure is the bone marrow transplant. That's what was told, that if she does not find a match, basically there is not much can be done for her. And this one is Rushi. He's 7-year-old. He also has the same condition. Ever since his born, we've been trying to find a matching donor worldwide. Alicia is just 15 months old. She is recently diagnosed with bone marrow failure and need a bone marrow transplant. She's 15 months old, but she looks like just 5 or 6 months old because she's not having the normal growth. And on the top, she is Kaya, 5-year-old. She was a healthy kid, no issues, and one day the parents noticed that she was having some bruises and went for the checkup and got to know she has leukemia. The family is desperately trying to find a matching donor, but unfortunately we do not have any donor for these kids. I just request everybody to take some time to learn how you can be part of the registry, how you can get tested. It's very simple. You can go to the website and you can contact me directly if you want to help. My number is 281-780-1379. And as Dr. Pingali mentioned, that donating bone marrow does not put donors at any significant risk. Recovery time is just for a few days, and these kiddos and the others can find a new life. It's like I have my own kids, so I can imagine for a parent, Salona, a child going through anything, how hard it is. And these kids are in and out the hospitals. They get blood transfusion, get pricked so many times. And on the other side, sometimes I hear that, oh, people want to help, but they are scared of the needles. So for those people, I can just say this thing, these kids are scared to needles too. But they have to go through it to get the treatment. And all the healthy people have option to go through that, and just it's a very small discomfort that involves, and they can save someone's life. So I request everyone to come learn more, and if you're eligible, then sign up. It's very easy. It's simple cheek swab test. The registration process can start at their home on their phone, and within 5 minutes, then they can complete the registration. They receive the kit at home. They just need to swab and mail it back. No need to stamp or address. Everything is taken care of it. So it's easy. So take your first step. Sign up.
Thank you so much, Gayatri. And ladies and gentlemen, we have been talking about bone marrow transplant. And please do visit Be the Match website and learn more about how you can give the gift of life to young children like the one Gayatri was talking about. And Dr. Pingali, thank you so much for being on Triple N Media. Ladies and gentlemen, please do subscribe to our YouTube channel, and we will see you next time.
Thank you.